This video is going to go over Chapter 18, Blood, Objective 6. So in Objective 6, we're going to take a look at the structure of platelets and understand the process of homeostasis. So platelets are also known as thrombocytes. A platelet is not actually a cell. It's kind of like a red blood cell. Red blood cells don't have a nucleus. Platelets don't have a nucleus. So what's happened is these megakaryocytes, which are huge. Take a look right here that the blue arrow is pointing to. That is a megakaryocyte. Look at it in relation to a regular old segmented neutrophil right here. My goodness, that is huge. And you've got these little bitty red blood cells in comparison to this huge megakaryocyte. Well, what's inside the cytoplasm of a megakaryocyte? When that megakaryocyte explodes, all the little platelets come out. So it's just a piece of a larger cell. You can see here, you've got your red blood cell, which kind of looks like a donut. It's not hollow in the middle completely. It's just shallow. Then you have your white blood cell, which is probably a lymphocyte, right? Because it's the same size as the red blood cell. And then you have this platelet right here. So again, the platelets in the red blood cells, again, don't have organelles. So taking a look at how many you have in your blood, again, I'm not going to ask you this specific number right here. What I need you to understand are red blood cells are most numerous, platelets second, white blood cells least. Okay, so I'm just giving you the numbers so you can actually put a number to me saying greatest and least. Platelets, some of them migrate to the spleen for storage to be released in response to any rupture of a blood vessel. So the spleen houses a good proportion of the platelets found in the body, about a third of them. They just stay there until needed. They last about 10 days, and then they are phagocytized by macrophages. Phagocytic, remember, means it's macrophages are going out and engulfing this particle, in this case, a platelet that's no longer viable, really, and it will destroy it. So it goes out and gobbles it up and destroys it. Platelets, their job is to stop blood flow following damage to a blood vessel. So whether it be an artery, a capillary, a vein, if there's some type of injury to that blood vessel that it's causing the blood to leak out of that vessel, platelets will come in and stop that. They secrete growth factors essential for growth and repair of tissues, specifically connective tissue. Hemostasis. Trying to think of what word I said a minute ago. I want to make sure I use that word correctly. I don't know that that was the word that's in that first objective, so I'll have to take a look. Hemostasis is the word I need you to know. I'm just going to back up a minute because I want to make sure I said that correctly. Homeostasis, that's not correct. That's what I was like. Homeostasis, that should not be homeostasis. There we go. That's what it should be. Hemostasis. So you need to change that because that was, I thought I said that wrong when I said it. Hemostasis. I'll have you take a look at that process here in just a second. But platelets are these key players in hemostasis. This is, by definition, a process by which the body seals a ruptured blood vessel and prevents further loss of blood. So you see here, you've got a ruptured blood vessel. Blood cells can exit that blood vessel through that opening now. So the next thing that's going to happen is after that vessel injury occurs, a vascular spasm is going to occur. We'll talk about what that is in just a second. Take a look at these little stars, these little purple stars, platelets. Those little stars, those platelets, form this plug to prevent blood flow out of that blood vessel, and then eventually clotting occurs. So these are the steps of hemostasis. First, the vascular spasm occurs after the injury. When the wall of the blood vessel is damaged, punctured, severed, whatever, a vascular spasm occurs, that smooth muscle in the blood vessel walls that constrict it dramatically. So keep in mind that you've got your blood vessel there, and the wall of that blood vessel, that middle layer, so that capillary, that blood vessel, even if it's a well, not necessarily capillary, but artery or vein. There's layers. There's the inside layer where the cells are kind of rubbing up against. There's the outside layer, and there's that middle layer. That middle layer is where smooth muscle is going to be found, and it causes massive constriction when an injury has occurred. And this takes about 30 minutes, by the way. It lasts about 30 minutes. And then formation of a platelet plug. That's step 2. Platelets normally float around in the plasma, but when they encounter a damaged area, they start to clump together and become all spiky. And that allows them to stick to tissue and to each other. This is a temporary seal, it's just a band aid. So that way, it gives the body time without losing blood constantly to make repairs later. So you can see right here this platelet aggregation. Remember, this was the only example of, besides childbirth, of beneficial positive feedback. So this platelet, blood clotting, and childbirth were the 2 positive or beneficial examples of positive feedback. So these platelets are bringing in more platelets and attracting more platelets to this site, asking for help. And then step 3 is coagulation. So more durable repairs are made during the coagulation phase. So again, that platelet plug, that's like a Band-Aid. This is actually sealing that clot or sealing that hole. So coagulation is the formation of a blood clot. The end result is a clot, which consists of a mesh of fibrin. Remember that fibrinogen that we talked about earlier? That's going to then come onto the scene. And these platelets and these blood cells are all going to become trapped. So that fibrinogen is going to kind of glue everything together. Platelets are going to show up, form that initial seal, and then fibrinogen is going to come along and kind of glue everything together to really prevent that from reopening. This is the common pathway of blood clotting. And you can see, like I told y'all previously, there is a series of steps involved. You do not have to know all these steps, but it is a lot going on. There's a lot of components. And if one thing doesn't go right, one thing is all it takes, this whole process will not occur. So question set 6 in your in-class notes for this chapter. I'll let you take a look at question 1 and 2, and then we'll talk about the answer. So the precursor to a platelet is a megakaryocyte. That reticulocyte, that's the precursor to a red blood cell. Where are platelets stored when they're not traveling through the bloodstream? The spleen. Remember, about a third of them are hanging out in the spleen. I'll give you a second to take a look at question number 3. So you should have 3, 2, 1. So that answer would be C for number 3. And that concludes objective 6.